Hey everyone, it's Argonath here from The Right Way, and again, the so-called health experts, the epidemiologists in New Zealand, are still trying to scare people about this friggin' Omicron outbreak in New Zealand, where most people don't give a shit anymore. They just want to get on with their lives. So let's have a read of this article. Leaked memo raises questions over Ministry of Health's daily COVID-19 case numbers. Now, if anyone happens to be watching this who is overseas, probably in your country, you don't really give a shit what the daily case numbers are anymore because they're meaningless. And of course they're meaningless. They're going to be meaningless at this stage because it's so prevalent, right? So what is all these epidemiologists going on about? So a leading, in double quotes, right, a leading epidemiologist says we have no idea how many community cases of COVID-19 there are in New Zealand because so many people aren't recording their rapid antigen test results. Of course they aren't, because it's like a flu to most people. They don't give a shit, right? And University of Auckland Professor Rod Jackson says an upgrade of the testing system and my COVID record are desperately needed. Why are we wasting money on this? It's so prevalent now, COVID. We don't need to know the case numbers. We just need to keep a track of how many people are being hospitalized and possibly how many people are dying because of the virus. But generally, they don't die because of the virus. They die with the virus because they have so many other underlying conditions, right? Again, they're calling for wastage of money, trying to scare people into thinking that we need to keep testing because what? Someone else is going to get COVID. For most people, it's a friggin' flu. Now, of course, I am triple jabbed, and I have no problem in saying that. I'm happy to be vaccinated because I think it'll save me if I do catch COVID, which I haven't yet. But I'm not going to come down on anyone who hasn't been vaccinated. That's their choice as far as I'm concerned. But there's no need to keep scaring people about, oh, we've got to keep testing people and blah, 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 blah. It's out there in the community. You're not going to pull it back in now. Let's have a look. His comments for the leak of a memo from the Northern Regional Health Information Coordination Centre of Health Providers in the Auckland region. The memo states the Ministry of Health shared the following with us this week. In the last month, we've distributed 50 million rats into the system, so that's rapid antigen tests, and so far less than 1 million results have been reported. So, of course, people who test positive with a rat and then they have to isolate for 7 days where they actually have to work and earn money to get food on the table are probably not going to do that either if it's just like a mild flu for them, right? They're going to go to work and keep earning the money so their family can actually eat, Rod Jackson. We're not giving out COVID money anymore to these people, right? The memo goes on to mention the increased number of false positives and negatives that occur with rapid antigen tests compared to PCRs, and the need to shift towards more PCR testing immediately. What planet are these health people on? With so many people testing positive, there's no way we can go back to PCR testing because it takes so long to friggin' do it. Jackson said that the fact that so many people are not recording the COVID-19 rat results means that the Ministry of Health daily case numbers are meaningless. You've only just figured that out, Rod Jackson. I knew that about 3 weeks ago. But the media hasn't figured it out because they keep reporting it because it's such a big number that they still want to scare people about this particular virus. Those numbers clearly demonstrate that expecting people to report the result of self-administered rat tests was never going to happen on a consistent basis, he said. They're only reliable if they're done by trained people and recorded. Well, that's not going to happen. We just need to give up on that kind of stuff, right? It's in the community. Everyone's going to get it at some point. We just need to help the people who get it and react very severely to the virus and protect them in hospital. That's what we need to do. We don't need to give a shit about how many cases there are. We just need to make sure that people who need help can get help. Right, so that's what we should do. We should bring a big advertising campaign going, look, we're not going to worry too much about COVID now, it's in the community, but if your symptoms are getting worse, you need to contact a medical health professional and go from there. That's what we need to be doing. Don't worry about all this friggin' testing and stuff, it doesn't do anything. Jackson said he doesn't even look at the daily case numbers. No one does anymore. No one gives a shit, right? I look at the hospitalization, sadly the number of deaths. But Jackson said in the middle of an Omicron outbreak, a switch back to PCR testing might not be feasible. Might not be. It's not feasible. Don't say it might not be feasible. It's not feasible due to the sheer number of people who would need to be tested. Why do they always use these measly words? Just use the correct word. It won't be feasible. There's no way it will be feasible. And my concern is people that have got used to easy access to rats and now they wouldn't want to wait. Of course, no one's going to wait 3 hours, 5 hours in line for a PCR test when it's a mild flu to most people. Rod Jackson. He said rats are a tool to help slow down the spread of Omicron, but the accuracy can be as low as 50%. Auckland University Professor of Public Health Dr. Colin Tukiatonga agrees that poor recording of rat results highlights the shortcomings of the Ministry of Health's daily case numbers. The reality is we have no idea of the real numbers because people are either not getting tested or if they are, they're not recording their results. So why do the Ministry of Health actually report them then? They should just stop reporting them. Just go, look, there are this many people in hospital, there are this many people that actually died. That's all they have to say. Don't have to put out the daily case number figures because no one is interested in it. Some people say the real case numbers could be 2 or even 4 times higher. It's probably even higher than that, I would say. He said looking at the overall trend shows case numbers are declining in Auckland, but in terms of absolute numbers we have no idea. A Ministry of Health spokeswoman said it's continued to monitor and review its approach to testing throughout the outbreak. The Health Ministry have just done an absolutely shocking job, apart from the initial lockdowns, and that's what we did that, not the Ministry of Health. They just told us what to do. We had to actually do it. But after that, it's just been absolutely shocking, the incompetence of the Health Ministry. No wonder that they're all jumping ship with today's news that Bloomfield and a few other medical professionals in the Health Ministry are jumping ship because they can see the writing on the wall. Everything's going to come home to roost to the Health Ministry at some point. She said rats are the Ministry's preferred testing method as they can be done at home, the results are available quickly, and when people upload their results, they provide an insight to the spread and size of an outbreak. We are still undertaking some PCR testing, however this is mainly focused on priority populations and those individuals who are higher risk of the effects of COVID-19. So according to the ministry, they have distributed 61.6 million rats nationwide. That's distributed, doesn't say that. That's how many have been actually taken. And a total of 1.6 million results have been recorded. Because no one gives a shit. As I said before, we don't care. Right, if I test positive, I don't care. I can probably isolate for a few days, but I'm not going to isolate for 10 days anymore like we were supposed to do. I think it's down to 7 now, isn't it? But again, those people who rely on their wage to come in, and if they're not able to claim for COVID sick leave or anything, which is also an added burden on employers as well, which is ridiculous too, for a mild flu for most people, then it's just ridiculous, right? There are many people who have COVID, mild symptoms, they could be working. Yes, it would spread the virus, but it's going to spread the virus anyway. It's spreading anyway. You're not going to be able to stop it, right? Just protect the elderly and the vulnerable people. That's what you should be doing. Anyway, that's my opinion. What do you think in the comment section? Love to read your comments. If you like this video, give it a thumbs up. If you don't like the video, you're welcome to give it a thumbs down. And if you like my content, please subscribe as well. Hopefully I'll catch you in the next video.